Hi, it's Dr. William. I'd like to point out something here. I'm doing a BBL on this patient. I've already done the lipo, and the lipo's done through the key area. She's a small person, so she has a small waist here. Even being a thin, small person, she already has this fat pocket here. And she already has good volume to her butt. But most of her fat is in this lower kind of sector here. And what we want to do is we want to bring out her hip. In most cases, after I bring out the hip, I'm grafting into the leg to continue that ogee line. In her situation, it's different. It's really the opposite because she already has volume and heaviness in the bottom, and she already has some fat here. So I don't want to really make her larger in this area, and she didn't want to, and I don't want to either. So the main goal in her situation is we want to bring out the hip and we want to fill this emptiness in. Her back kind of comes down and is very flat in the upper part of her butt. So we want to have a better transition. Now, how far do I bring it out? It's really just dependent on what this line looks like. So this convex part of the ogee is coming up here, and then she gets flat. We want this to be a nice smooth line that goes back up to the key area. So that's what I'm principally doing, is filling in this area. Okay, so let's take a look at her preoperative photos, and it'll help explain what I'm talking about. One of her worries was a deposit of fat here that she felt was quite heavy, and you could see it here better, I think, on this side, where you sort of see that that's sort of a heaviness here. She had originally asked me to liposuction there. The problem is, if you liposuction through here to thin this out, it's going to change this line. And if she had a fat deposit that was really coming out like this, that disrupted that line, then yes, I could do some lipo and remove that. But her line is nice. And if you look at the front, her line here is also very nice. And so I just felt, if I lipo this through here, it's going to make her straight and it's going to disrupt the line. We're always trying to get the ogee line. So even if we just look at this line, we don't really want to have this shape. That's not the goal. The goal is to have this shape. Yeah, I know this guy's droning on in that monotone voice, but stay with it because it gets better towards the end. But if you have a question or a comment, leave it in the thing and then I will answer it next week. So in order to achieve that, because she's got some fullness here and because this line is already nice, and if you look at the volume of her butt, it's really more just in this lower part where she has volume. She really doesn't need more volume here. What she needs is to have this area of fat removed. That will start to bring that line in, and then we connect these two lines. Now, this is kind of flat here. It's really noticeable here. It's very flat. We want that to have that nice little arc. If you just follow the ogee line, it takes you where you need to go. And this is exactly what I mean here. Look at this line. This line is coming up here, and now we're flat. Well, just follow the line. Where does this line lead you? It leads you right up here. This line will come in here, and now it starts to shape into that nice ogee shape. So that's always the goal. Correct this irregularity and just follow. She kind of took care of the convex part for a lot of it. I had to kind of come up to this part here to fill this in, and then it's the lipo in the upper area that starts to get you that nice concave line. So that's the plan. And I've done it already on her right side. This is some bruising, so don't be alarmed by that. But she already has a really nice, there's always a little bit of loose skin in the key area after lipo. But now what's happened is this line is coming up, and now it's just being smoothly going in. That's the convex part of the ogee. And I filled all of this in. I've put a tiny bit of fat in this area just to kind of blend where I have it in the other. But most of my fat that I have placed in her has been in the upper part. We want to balance her butt. It's really quite unbalanced. So now I have a nice round, it's nice and full, So we're going to do the same thing, but it's just if you compare the lines, here this line is really coming out nicely. Here it comes out nicely. This is all her, but then it's flat here. And so that's what we're really concentrating on, is just trying to get that really nice line here. Okay, so I finished both sides now, and this is, to me, just absolutely phenomenal, because we can actually completely change her butt. This is what I love about this operation. And where she had this real hollowness and flatness and heaviness, and this kind of stood out and she didn't like it, now with this nice convex ogee shape, this just flows right in. If you just look at her flow now, it's really pretty. And these areas that were sticking out before, they're not. Now they're just completely part of her body and just has a nice, smooth, pretty line. That's why this operation is just so incredibly powerful. Okay, answering Jennifer. Jennifer asks, my question is, do all women with droopy and saggy breasts need a breast reduction? And then someone else answered, which was great. They said you can get a lift without it requiring a reduction. Some people even get fat or implants put in at the same time. I said, well said. And then someone who asked me the original question said, how do you know which one I need? So let me explain it to you here. But thank you for answering that question for me. So let's just look at the different sort of styles of breast you can have. This is a line here that represents the inframammary fold. That's the fold underneath your breast. People call it the breast fold or breast crease. If your breast looks like this and you're happy with your size, you do nothing. If you want to be larger, then that's when you get an implant, and that's called a breast augmentation. If you're here and your breasts have a little bit of softening but not true droop because the nipple's still at or above the line of the crease, then usually what will happen is you can still have a breast augmentation if you want to be larger. But once you get over to this group, these people have droop. Now, how do you determine if you need a reduction, need an implant, or you don't need, how does all that work? Well, it really just depends on what you want. So we look then at size. Are you happy with your current size, but you still have a droopy breast? Or do you want your breast to be bigger? Or do you want your breast to be smaller? If you're happy with your current size, but you still have droop, then we simply do a lift. If you have droop, but you want to be larger, then we do a lift, plus we add an implant, or we can use fat, sometimes both. If you have droop, but your size is too big and you want to be smaller, then this person will have a breast reduction. So whether you're having a lift, whether you're having a lift with an implant, whether you're having a lift with fat grafting, or whether you're making your breast smaller, it's all a lift. It just depends on what you want to do with your breast that determines whether you get a reduction, just a lift, or a lift with an implant or fat grafting.